Hi guys, I hope everyone's staying safe at home. This is just a quick video for anyone who might have broken one of their adult teeth and you find yourself in a sticky situation like this. Before I start, these are very unprecedented times. I've spoken to a lot of dentists across the whole country and we're working very hard just to get ourselves back in the clinics, and really we just want to get back to helping our patients out in a way that's safe for you guys and for our staff. Hopefully that will be sooner rather than later. So I'm going to show you how to place a temporary filling. This is only if you have a broken tooth. Unfortunately, if you're in pain or you have a swelling or an ulcer, so wisdom tooth, this isn't going to help. This could actually make things worse. So again, I'd urge you to contact your dentist first and get some advice and make sure that they're happy for your specific case to use this video. It's very much just instructional. It's not a substitute for dental advice. For example, if you had an infection in one of your teeth and you put a temporary filling on top of it, you're trapping the bacteria. So if you think of your tooth like a can of Coke, you're keeping all the gas in there and you get a build-up of pressure and you'll make it a lot worse. So again, this is really only for just a kind of a clean break, maybe with a bit of sensitivity, but certainly not if you have an ache or a throb, or certainly a pain that gets worse when you lie down or you go to sleep or anything like that. This is from my local pharmacy. It's just a temporary filling kit. They come in different shapes and sizes. Read the instructions, very important before you start. Some of them will come with eugenol, which would be which I'd prefer. Some of them don't. So if you don't have this little bottle of eugenol, just skip that step. So first thing I want you to do is to get a helper, someone you trust to basically help you do this. You're going to want to use a torch. It looks simple here, but when you're in the mouth, you're going to have a tongue, saliva, it's going to be dark in there. So if you have a head torch, that would be even better. So first off, get some warm water, mouthwash, rinse your mouth, and make sure you get the tooth nice and clean. This will get rid of any food or debris that you have in there. So let's start with this tooth here. This step you can actually skip. It's if you have a very sharp edge, you can consider this. If you're not fully in control, you don't feel comfortable, just skip this part. But it can be useful if you have a really jaggedy edge. Get the smallest bit of sandpaper that you can. Make sure you're looking in the mouth, mind your tongue and your gums, and just gently brush it off the sharp bit. Have a little feel with your tongue and that actually feels better. And that's all you need to do, nothing too aggressive. Next part, I want you to make what we would use cotton rolls in dentistry. So just something makeshift. Get a piece of kitchen roll, tear it into 2 halves, then fold it once, and then you're just going to roll it up like a sausage. Nice and simple like that. And this is going to help a lot with saliva. Once you have it made, cut it to shape, because I guarantee it will be too large. Something like this. So, and here's what I made earlier. And basically your helper is going to put these on either side of the tooth if they can. And this is where you have everything ready in advance. So just watch the video in its entirety before you go on. And you're holding them with one hand. So very simply, what you want to do then is dry the tooth. So you have 2 options. You can use a little bit of compressed air. Don't put it directly in the tooth, just a little blast like that, and the tooth is dry. If you don't have that, or if the tooth is very sensitive, I'd recommend just getting a bit of kitchen roll, put it on the tooth, bite down. That's just to remove any saliva that's in there. And again, if your tooth is quite sensitive to cold, I'd recommend skipping that step. So first up, we're going to apply the eugenol liquid. So this is the little applicator that comes with the kit. So you just dip it in. 1 drop is plenty, and you only want it to touch the tooth. Keep it away from the gums, tongue, stuff like that. And you rub it into the little cavity, and that's perfect like that. This is helpful if the tooth is sensitive. And eugenol, as some of you may know, is clove oil, and it's very helpful for getting the temporary filling to stick to the tooth as well. So next up, we're going to get the temporary material out. You have a little cutter on the end of this, so cut it off a little bit. You don't want to use too much, you might need it again. Most likely, it's nice to keep this around the house anyway. So roll into a little ball until it's nice and smooth. Yeah, very good. Then put some on the little applicator tip, like this, and then put it into the cavity. So I hope you can see that now. And what you do is just pop it in, push it down, And then this part's quite important. I like to get a little bit of eugenol on my finger. Not too much. And then you can actually just smoothen the edges with that quite simply. So that should look nice and clear now. Now, the next part's very important. So you've got this in, you've smoothed it off. Very important. This is will start to set once it kind of touches your saliva. So what you want to do is bite the teeth together. So you close and go tap, tap, tap with your teeth. Anyone who's been at the dentist is probably familiar with this. And this will bring it down, because if it's too high in your bite, the tooth will be sore and tender afterwards. So we'll just smooth them down. The material is good at wearing away if it's too high anyway, so don't worry too much about it if it feels a little bit high. So then after you've done your bite, go in again with that finger and just smoothen the edges, because it might have roughened up again. And then last thing you'd want to do is bite it together, then rub your tongue over it, and the saliva will basically make it set. What you can do then is, when it's sort of setting, go in with the little TP brush and just make sure you go in between your teeth, because the last thing you want to do is get any of that trapped down near your gums. Once that's in, don't eat anything for 3 hours, and hopefully that will help. If you're having trouble, obviously just get in touch with your local dentist. And I'm going to do this on one more tooth just quickly to show you the steps one last time. So get your cotton wool or your kitchen roll, get it nice and dry, dip in your eugenol, get the tooth nice and ready, get a little bit of the temporary filling material, roll it into a ball, pop it on the tooth, push it down with your finger, and then this is a bigger cavity, so it's actually nice for you guys to see this. This will be a very large one, and again, this tooth has no pain, and it's not attached to anyone. And then we're going to put another little drop on here on the side. A little bit of eugenol. And again, the drier you can keep this while you're placing it, the easier it will be. That looks nice and smooth. So you're going to go in with your little TP brush. Now, get the patient to bite together. Go tap, tap, tap. It will be a little bit rough after that, so go in again with your finger. And then give it a good rub around with your tongue. Get the material setting. Don't eat anything for 3 hours, and hopefully that will help. Okay, guys. Fingers crossed that will have helped a few people out. And again, hopefully we'll see you all in the clinics very soon. Take care.